Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great videos featuring the very latest technology, our stellar doctors, and inspiring patient stories. Okay, do you have an ongoing battle with your kids over what to eat? Eat your fruits and vegetables. It's a common rallying cry for parents, but chances are your kids would rather go for pizza, potato chips, cookies, cake, and soda. What's your kids' go-to food? What do they crave? And what's their favorite fruit and vegetable? Please leave it in the comments section below. According to the American Academy of Pediatrics, nearly 1 in 3 children in the United States is either overweight or obese. So how do you get your kids on the path to healthy eating? We're going to talk about that with 2 pediatricians from Scripps Clinic in Carmel Valley, Dr. Mackenzie Coffin and Dr. Daniel Lichtman. Thanks so much for being with us.
Thanks for having us.
Why is healthy eating such an issue for kids?
Well, I think building habits early on is huge. So it's not just for their nutrition at a young age. It's also to build the right habits for when they're a teenager or an adult, and they have to deal with diet a little bit more.
So according to the CDC, empty calories from added sugars and solid fats contribute to 40% of daily calories for kids ages 2 to 18.
It's a huge number.
That's staggering.
And I think, depending on where you look on these things, sometimes you'll get various different numbers, but I think in general we know it's too high. And I think, even things like chocolate milk, people think it's good because it's milk, and my kid likes chocolate milk, and I can get him to drink milk if we put chocolate in it, but if you look at the sugar content, it's actually quite high. So I think, really paying attention to what beverages, because they're a huge source of just empty calories.
Well, that's what they say. The CDC, the Centers for Disease Control and Prevention, say half of these calories come from 6 sources: soda, fruit drinks, dairy desserts, grain desserts, pizza, and milk. As you say, go back to milk and you think milk is really good for you. Mm-hmm. So why is it important to establish healthy eating habits at a young age?
Well, as I mentioned, building the right habits makes it so that you're able to do the right things when you're in a position where it's really going to affect your health that much more. And you're talking about when you're an adult, if you are overweight and you're obese, you're at much higher risk for high blood pressure, high cholesterol, diabetes, early heart disease, all those sorts of things.
I think we know that, the habits that you get set from the time you're a child really do follow you through your whole life. If you get used to eating when you're watching TV, that becomes a comforting activity for you, and then you do that your whole life. So trying to get kids into mindful eating so that they're not setting up these habits, I eat when I'm bored, or I eat when I'm
stressed.
Yeah, stressed, when I'm sad, using food just for healthy nutrition to nourish your body. And I think teaching kids what the point and purpose of food is very helpful.
So we want you to hold this thought. We're going to come back and talk about this a little bit more. I know you referenced it, what happens down the road if you don't establish these healthy eating habits at a young age. What are the consequences? What are you setting yourself up for? And you referenced it a little bit, but I want to go into kind of greater depth. So hold that thought. We'll come back to that in just a couple of minutes. Let's talk about some examples of healthy food for kids.
Yeah.
Sure. So, when you're talking about eating, the way that our society typically eats throughout the day, we have meals, right? Breakfast, lunch, dinner. And kids, they're growing and they're active. They need snacks throughout the day as well. Typically a couple of snacks all the time, right?
You're a kid at heart.
I am. It's true. I haven't outgrown that.
One thing Mackenzie always talks about, I hear her talking to patients, is having the right snacks available at home, and thinking about foods that need to be refrigerated are often more healthy. Mm-hmm. They're perishable. They're less processed.
So examples of healthy foods, obviously fruits and vegetables.
I always tell people, when you're hungry is not the time to have to prepare your food, right? Because you're hungry, you just want food. So you're going to go wherever it's easy, which is either the pantry for many of us, but hopefully we can turn that into the refrigerator. So you can have cheese sticks in there, you can have whole fat. For younger kids, less than 2, Greek yogurt. Over that age, you can do Greek yogurt that's not whole fat, but it's got a great source of protein, got good calcium. Cutting up fruits and vegetables ahead of time, or if you're like me, you don't want to take the time to cut up fruits and vegetables, so you just buy the ones that are pre-cut for you, but they still work, they're great, and you can just grab those. You can munch on celery, you can munch on carrots, put some hummus on it, make it more flavorful.
So let's give some sample meals. What would you offer up as a healthy breakfast?
Yeah, I think yogurt with a little bit of granola in it, fresh fruits, avocado on the side of whole grain toast with some eggs. Those are really good breakfast sources.
And what about a healthy lunch? A school lunch, for example, what kids could take to school.
So that's another thing that, trying to take, a lot of times I think we don't pack certain things because we don't have an ice pack. We can't keep it cool during the day. But if you send your kid with an old-fashioned lunchbox that's got an ice pack in it, you can do yogurt, you can do hard-boiled egg, you mentioned healthy sources of meat. So
Yeah, so, some sort of deli meat. Now, a lot of the deli meats you buy at the stores are processed, or there's nitrite. Well, you can go to the counter at your local grocery store and you can get freshly sliced turkey breast or freshly sliced roast beef. Those would be good on a whole grain sandwich. Maybe just use one slice of bread for the meat that you have so you're not getting too many carbs.
What about tuna fish?
Yeah, tuna fish is great. You do want to limit the, mercury exposure. So I think a lot of sources will say in moderation, not every day, but, weekly or every other week. Yeah.
And what about the go-to for kids, peanut butter and jelly?
Absolutely. I think hard is a lot of the schools have become much more nut allergy friendly. So when your child's going to school, you may not be able to pack peanut butter and jelly sandwiches, but that's a great lunch go-to on the go during summer vacation when they're off to camps, that sort of thing.
Yeah, and really if you're looking at how to make that even healthier, pick whole grains, pick bread that has higher fiber content, and really one piece of bread with the same amount of filling can be a great way to cut calories as well.
And I did mention peanut butter and jelly. The jelly portion of that is very sugary.
I was going to say, there's a lot of sugar in that.
And so substitute that with some fresh sliced strawberries or put some raspberries, bananas. Makes it a little bit healthier.
Because the juice will soak into the bread over the course of the
Absolutely.
morning while the kids are waiting to have lunch. Yep. What about dinner? What would you suggest as a healthy meal for your kids?
Yeah, I mean, anything you guys are eating, as long as it's healthy, go for it. But, chicken breast with a little bit of pasta or rice. And then make sure that the rest of the plate is filled with fruits or veggies. A small piece of red meat, it's totally fine, right? As Mackenzie said, everything in moderation. You're allowed to have certain foods that may have a stigma of being unhealthy. You can have those, but it's all in moderation.
Yeah.
And what about dessert?
Yeah, dessert's a fun topic. Yeah, and I think teaching kids that food is fun and it's supposed to be fun, but you also have to eat the things that are healthy, and you don't need, we were talking the other day, you don't need to have dessert every meal. But some things, we have in our head, dessert has to be cake, it has to be pie, it has to be cookies. But it can be anything that's delicious. So you can do fruit with a little bit of whipped cream on it. That's a lower calorie option.
Savory desserts are making a comeback too.
Yeah.
I mean, it doesn't have to be something
what's
sweet.
a savory
well,
dessert?
You go to some other countries and they have, not to say it's that much more healthy, but they may have a plate of cheese and fruits. And that's a dessert. That's an after meal type of a snack. And that's a dessert. So I totally agree with Mackenzie. It's not all about the whipped cream and the chocolate syrup and the ice cream. You have other options.
But isn't ice cream a good source of calcium?
It is, and it can count as a serving. It just shouldn't be your staple for one of your daily servings of calcium. But frozen yogurt, if you're going with the ice cream option, frozen yogurt's better for you than actual, full-on ice cream too. But even the full-on ice cream is okay. You just want to make sure that it's not part of your habit, that you're not doing it every day.
Night.
Yeah.
And not a big pint of ice cream, right? And so that's the other thing that we always circle back to when we're talking to families and talking to teenagers and talking to kids is, one serving of ice cream is not this big. Mm-hmm. One hamburger patty should not take up, it shouldn't get 2 or 3 hamburgers. It should be, one scoop of ice cream is one scoop of ice cream.
Yes. Which is somewhat sad when you start looking at serving sizes. I remember when I first started paying attention to serving sizes, and I was relatively sad for a few days, but then your stomach and your mind get used to it and you become full off of less, and it actually is more satisfying because you're not over inundating your taste buds with the same taste over and over. You just have the exact right amount and you feel full and satisfied after that.
And what about cookies?
Cookies are good.
I like cookies.
Cookies are great,
Yeah.
yeah. But like, for example, what about an oatmeal raisin cookie as opposed to a chocolate cookie?
Yeah.
Or even oatmeal chocolate chip cookies.
Yeah.
And really like the size, are you having one cookie? Are you having 3 cookies? Yeah. But there's also, granola bars can be equally as delicious to a kid as a cookie. And it's just got a little bit more fiber in it, a little bit more nutrition than the flour from the cookie.
Yeah, and there's other, there's breads people make, banana bread that has, it certainly has bananas in it and fruit, zucchini bread. You can make breads that have veggies or fruits in them that increase the nutrient.
And you referenced it before, but it is important to make the cooking fun and involve your kids in it, right? Because then they kind of have more of a stake in it.
Oh yeah, kids love to pick out what they're gonna eat later, and I picked out this one, and they feel proud they picked out a good, apple or whatever it is that they wanted to eat at the store. And making it fun you always talk about kind of having it be a family time.
Mm-hmm. Yeah, for sure. Yeah, I mean, actually, I have a toddler. She's 1.5, and back to the picking out foods and options. I always have to bite my tongue because it's like, do you want avocado? And it's like, no. And it's like, I should have phrased that as, do you want avocado or do you want banana? Or do you want to have the avocado or should I give it to mommy? And that always tricks her, right? And then she's more interested. If she gets to choose the food, she's more likely to eat it.
And what are some guidelines for nutrition for kids? I know that you like a website called, is it choosemyplate.gov, right? Choosemyplate.gov. But talk about the nutritional guidelines. What should you be thinking about as you're preparing meals for your kids?
So there's still, basically 5 major food groups: dairy, fruits, veggies, grains, and proteins. And throughout the day, you should get a variety of those things. They've moved a little bit away from, I think, maybe people remember 20, 25 years ago, the food pyramid, right? Choose My Plates, there's a kind of a newer version and helps guide you a little bit better, where there's a little bit more wiggle room than just, you got to get this many servings of this many servings of that.
And in general, we know that it's hard to get your kid to eat exactly the right number of things. There are vitamins out there that can kind of help supplement, but the body uses nutrients the best when it gets it in the form of food. So the food is always better than the vitamins. So the general idea, I usually tell patients, try to have a fruit or a vegetable about 4 or 5 times a day, spread throughout the day. Have 3 to 4 servings of something with calcium in it, whether it's cheese stick, almond milk, whatever it is that you're using, ice cream sometimes. But and then meat, you should be having something with protein and iron. So that's why meat's important, protein and iron. It does have vitamins and minerals too, but protein and iron are the main reasons I think to encourage people to eat meat. And if you're not doing that, if you're a vegetarian or vegan, really getting some advice from a nutritionist, especially a pediatric nutritionist, to make sure that there's no holes in the diet there.
And you referenced it. Let's talk a little bit more. Would you recommend vitamins for kids? Would you recommend supplements for kids?
So I don't usually recommend vitamins for the majority of my patients because of that reason. We absorb nutrients better with our diet, and I also feel that you don't want to use the vitamins as a crutch. Well, I don't have to push the fruits and the veggies or whatever because my child's getting a vitamin. So I don't push it very often. Now, there's definitely times where you use a vitamin to transition until you can start getting some of those foods into the diet.
Yeah, I think for the most part, just encouraging kids over time to get a well-rounded diet is the best way to go. If there are, some patients I have maybe have milk, allergies or can't have a lot of dairy. So in that instance, there's a very clear hole for calcium in the diet, so a calcium and vitamin D supplement. But for the most part, once you're over a year old, you no longer need that vitamin D supplement every day that we recommend for babies. But I think that working on the diet's the best way to go.
And then what about fast food? Because fast food is popular for kids and it's easy to prepare when mom and dad are rushing, to get home and put dinner on the table. Can you have fast food that is healthy.
Yeah, I mean, there's options at every restaurant that you go to that's fast food. There's definitely ways to make it healthier. Now, most restaurants, salads, they have veggies, fruits. Now, your young child may not go for a salad, obviously, but grilled versus fried.
Whenever I go, I always want fries. I can't go and not get fries. So if I go with a group, and then, not everyone has to get the combo meal. So you can do one fry order, or you can, depending on how many people are in your group, and then each person gets a little handful of fries. You don't have to have one per person. Also, biggie sizing. Do they still do that? When I was 12, I
they
remember
have different
the
levels
biggie
for
size.
sure.
Yes, you don't need a biggie size if no one really needs to biggie size. But yeah, so portions, and then trying to pick the healthier
So
option.
you don't need the super size.
Don't need
Right.
the super
No,
size.
the super size.
Yes.
And
yeah.
I think that it goes back to the sugary drinks also, is that fast food does not need to come with a soda or a fruit juice. A lot of these restaurants, they do a good job of having alternates, but instead of doing a soda, I don't necessarily want you to go for the 100% fruit juice that sounds more healthy but still has a lot of sugars. The average kid in America nowadays gets about 30 gallons a year of sugary beverages. It's an astounding number, and it's way too much. And so water or milk with your meals is really what I go for.
All right, let's come back to this. We talked about this a little bit earlier. If you don't establish healthy eating habits at a young age, what are the consequences? Now, what are you setting yourself up for as an adult? Now, I mean, you talked about high blood pressure. What else? And diabetes, you talked about. What else?
High cholesterol, joint disease, chronic back pain.
Early heart disease, diabetes is, I think it's not just thinking diabetes, I have diabetes, but diabetes is going to affect all of your body. It's going to affect your heart. It's going to affect your kidneys. It's going to affect your blood flow to your toes and to your hands.
Your vision.
Your nerves. So it's really all encompassing.
Yeah.
Osteoporosis. Cavities.
Yeah.
Absolutely, and
Okay.
and
That
the
was surprising.
sugary drinks and gummy candies are kind of like a dentist's
Including
worst
gummy vitamins.
nightmare.
Yeah, gummy vitamins too. They get stuck on your teeth just like a gummy bear would.
And what about iron deficiency?
Especially in kids who drink too much milk. So if you're, elevated BMI and you're having more milk than the recommended amount, which usually after one is somewhere around about 24 ounces or less a day, that can actually inhibit iron absorption and make you too full so that you don't eat iron-containing foods because you're just full off of milk. So yes, definitely can affect that. Yeah.
And then what about cancer?
Yeah.
Yeah, I
It's
mean,
an
there's a lot.
inflammatory condition.
Yeah, anything that causes chronic inflammation in your body can set you up for different types of cancer.
And what would cause chronic inflammation of the body?
Obesity in general is just an inflammatory condition. We know that it does inflame the body, and some of it is probably just physical trauma, the amount of pressure that's put on the joints.
Yeah, and one of the main organs that's affected with increased fat in the diet or obesity is the liver, and we know that there's an inflammatory cascade that starts off with your liver causing liver damage in people who are obese and overweight, and that just leads kind of to more systemic illnesses.
So what foods should you avoid if you're trying to decide, okay, eat this, not that? What should you avoid? And then on the flip side, what should be your go-to food?
That's where I like to give the example of the pantry versus the fridge. So if it's kept in the pantry, the chances of it being one of your should-be go-to foods is lower. So anything that's a processed carb, anything that really doesn't need a refrigerator to keep it well past like 2 days,
So you're talking about cookies, crackers,
chips, pretzels,
Yep. Sugary drinks.
Yeah. And even, some people think, oh, well, trail mix is healthy. It can be, but when you look at the serving size of nuts, it is like a quarter of a cup. I think this is true. A quarter of a cup of nuts. So a very small amount. So when you think of how you eat trail mix out of a bag, that's probably about 6 or 7 servings. So go-to foods, fruits, veggies that you've already cut up, don't have to think about it. They're already there. Healthy dairy, like low-fat cheese stick.
Whole
Greek
grains.
yogurt, hard-boiled egg, handful of nuts. Anything that's, got saturated fats, all of those kinds of things you just want to kind of avoid fried things, lots of processed stuff.
What about butter on your bread versus something else?
Sure. I personally am a believer in, rather than just substitute what you're having in your diet, to really follow that policy of moderation. So I actually am okay with a little bit of butter on bread, but you're not smearing a whole bunch. You're doing a little smear to get a little bit of more flavor if you need it for your bread. I wouldn't necessarily substitute with something else, but you could substitute it if you wanted to with avocado or a nut butter that has a little bit more nutrients than just straight butter.
Yeah.
Any final thoughts?
I think, again, I just would give a big plug for building habits and know that the changes that you make with your kids' diet really should be a family thing, right? If 4 out of 5 people in the family are eating a different way than one person, it's not going to hold. It's about making there be a good culture for the family in terms of how you eat, and that's going to serve well throughout your child's life.
And I think, don't be discouraged. Any change that we're trying to make as adults, as kids, it takes time. So the more time you spend on task, the more times you try. We know it can take a kid up to 10 times or maybe even more of trying a food before they actually think they like it. So
I like to always tell my patients, the rule is you have to try it, okay? If your mom or dad says, let's try this tonight, you got to try it. If your mom's okay with it, your dad's okay with it, you can politely spit it back out and throw it in the trash can if you don't like it. You don't get in trouble if you try it, but you got to try it, because otherwise you're not doing a service to yourself or to your family or your health in the future.
Yeah. So keep trying, and offer. Just on the plate, there's lots of different space. So offer a new food in that new space, in that one space every night, and just, like you said, try it. And then the rest of your nutrients come from everything else. But over time, that diet will expand.
And keep eating together as a family. That's what I always say. Eat as a family, and then you're less likely to have as much junk and kind of that boredom eating.
Thank you both very much.
Yeah,
We appreciate it.
Yeah.
If you want more information on healthy food for your kids, just click on the link or go to scripps.org/videos. If you want more critical information about your health, we take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.